Good day, everyone, and thank you so much for taking the time to watch this recorded training on how to access, navigate, and complete the survey for HCBS, or Home and Community-Based Services, providers of clinical and therapy services, care coordination, supportive skills building, assistive technology, and personal support services rate determination. My name is Emma Finestone. I am a consultant with Public Consulting Group LLC, or commonly known as PCG. And PCG is the authorized vendor to the department that is conducting the rate determination process for certain HCBS services found under sections 12, 18, 19, 20, 21, 29, 40, 96, and 102 of the MaineCare Benefits Manual. We are working together with the Office of MaineCare Services, and the comprehensive list of service codes included under this rate determination process is available at the Rate Reform website. I'm going to be doing a walkthrough of the survey, showing you how to access, navigate, and complete the survey, which has been developed to collect information from providers and other interested parties regarding the included services, which also include some financial and utilization aspects. The results of the survey will then be used to further inform the rate determination process that has commenced regarding these services. What I would like to just make very clear from the beginning is that the survey is hosted through a HIPAA compliant platform to ensure the security of your data and information. I'd also like to note that all survey responses will be kept confidential and provided in a de-identified format to ensure data privacy and integrity. So once again, just to highlight that the survey is both HIPAA compliant and will be kept confidential. So on that note, I'm going to share my screen and show you exactly what it looks like when you click on the link that was provided in the notice around the survey and is accessible through the Rate Reform website. So once you hit that link, this page should automatically pop up. It would be accessible through any web browser. So that could be through your mobile phone, a tablet, laptop, or personal computer. As long as you have access to a web browser, you should be able to open up this survey. At the top, you'll see there's just a brief overview noting which sections of policy these services are included under, as well as a link to the comprehensive list of service codes on the Rate Reform website. Here, if you click on this link, it'll direct you straight to the list of codes included and that are asked about in the survey. The other thing I just want to note here is that if you have any specific questions after watching this recorded video, please feel free to reach out to this email address, mainehcbscnn@pcgus.com, with any questions or comments, and we will get back to you as soon as possible. And then just before I dive into some of the questions, I'd like to thank you again for your participation in this process. We truly value your feedback and input as providers and interested parties, and we really encourage your continued participation throughout the rate determination process. So on that note, I'll move along to the first question, which is really for us to understand how you engage with HCBS services, specifically MaineCare HCBS services. So the first option we have is that you're a provider, or that you're an individual, a family member of an individual utilizing the services, part of a government or advocacy agency, or if none of these are applicable, you could hit this unsure/NA. I'm going to be selecting that I'm part of a provider organization, simply because we believe that most of those filling out this survey are going to be providers. And then additionally, the questions for all other groups are pretty similar to what we have under providers, but there are a couple of extra or additional questions for providers. When I get to that point in the video, I will just indicate which sections are relevant to providers only, so that anyone watching the video who is not a provider could stop watching the video at that point. So the next sub question is around the name of the organization. I am just going to call this Test Inc. because we're busy doing a draft or dummy data submission, just so that I can walk you through the entire process. What I also would like to note is that any of the questions with this little red star or asterisk mean that you must complete or provide some form of input for that response in order to move along the survey, whereas questions without that star do not require that you enter the name of your, that you input data into that specific field. Next, we ask for your first name. I'll be putting my name in here. The reason that we ask this question is just so that we have somebody to reach out to should we have any questions about the data. But I would like to reiterate that the data will all be de-identified and kept entirely confidential. This is really just for follow-up purposes. So once again, I'm just going to be entering some dummy data here. The next question is around where you engage with MaineCare HCBS services. So here, if you could just select all counties that apply. Again, you do have this option of unsure or not applicable if that is the case. I'll just show you briefly that you can select a couple of counties. You can select as many as you want, so please do select all that apply. This is the end of the first page of the survey, and what I'd just like to note here is that if for some reason you're unable to complete the survey in one go, you will be able to save where you are and come back to it at a later stage. However, you will be prompted with this sign up box, and the sign up process is really very easy. You'll just need to enter your name and email address and create a password, and then the link to your saved submission will be emailed to the email address that you enter over here. What I do just want to note is that we won't be using that information for anything. It's really just so that you have a way to access your submission. In the case that you're going to be completing the survey all in one go, you can hit next. The next two questions are really around service gaps and barriers to accessing care. Here again, we encourage you to please select all that apply. And I'd also like to reiterate there would be no penalties whatsoever for your answers here. The data will, as I mentioned, be de-identified. On both of these questions, which ask around, the first of which asks which areas you feel that services may be lacking or missing, and the second of which asks which you believe some primary barriers to accessing care are. Both of them do have the option to say unsure or not applicable if you don't have an answer on either of these, as well as having an other and then providing you the opportunity to specify what other service gaps there may be. So please, if you select this other box, please do provide some additional input over here. I'm going to go ahead and just select care coordination for today's purposes. In the second question, we have a very similar structure. So once again, we have the option to say unsure or not applicable. And then if you do say other, you'll have the opportunity to enter some additional information. Here, I'm just going to hit transport. Okay, so once again, here you see that you have the opportunity to save your response or move on to the next page or do both. I'm going to move on to the next page. And this is where the questions really move along to provider specific questions only. So if you are, if you interface with the system as anyone but a provider, you're welcome to stop watching this training. straight after the last page, you would be taken to the end of the survey and be able to hit submit. But if you're a provider, I strongly encourage that you continue watching. So the first question that we have here is, which sections of policy do you or your organization provide services under? Please select all that apply. And what we're really doing here is getting an understanding of which of the service codes included in our study you would be looking at, or which are applicable to you, so that we can make sure you're only answering questions that are relevant to your organization. So for example, here, I'm going to select section 12, 18, and 96. A follow-up question then pops up around, which of the following codes does your agency bill under? Please select all that apply. You'll see these are grouped by section and are filtered based on your responses above. So for example, if I deselect section 12, I no longer see those codes. I'm going to leave it in for now. And the idea here is really to further refine the questions that are coming up next, to make sure that we're only asking you questions about things that you can answer. You know, we don't want to be asking you questions about codes that are irrelevant to your agency. So we really only want to be looking at the codes that your agency bills under. So here I'm going to select a handful of codes. I'm just going to select 3 codes for the sake of brevity, and then continue on to the next page. This page speaks to some more general organization information. So the first question is around a distribution of direct staff. Direct staff should be employees who provide services directly to individuals. And what we want to understand is how they spend their time across various activities. So what we ask is, to the best of your ability, please provide the percentages for each activity performed by your direct staff. And this is really at an aggregate level. The purpose of the table is for us to gain an understanding of how your direct service staff are spending their time over the course of a fiscal year. And what I'd also like to note is that you'll be provided with an opportunity to give some further information about time spent by activity or by service code in the next section of the survey. So this is really just like an overarching answer. So we have broken this up into a handful of categories: developing and updating care plans, assessments and reassessments, traveling to and from individuals receiving services, providing services to individuals directly, procuring items and devices, and administrative activities. And essentially what we'd like to do is make sure that this percentage sums up to 100. So for example, if we say 5% of staff time is spent on developing care plans, 20% of staff time is spent on assessments, 10% on traveling, 50% on actually providing services, 5% on procuring items and devices, and then 10% I believe we should be left with 10% on administrative activities. So we just want to make sure that this sums to 100%, making sure that, you know, we're accounting for employees full time. This is also, again, just to give us an understanding of how much time is spent providing services directly to individuals as compared to the additional tasks. Then our next question is around total annual overhead costs. We're asking that, to the best of your ability, you indicate the average total annual overhead costs associated with the services indicated on the previous page. So for example, if I believe the overhead costs of my agency to be $100,000, I would just input that over here. The next question is a follow-on question. we want to understand if you could break that number down, how much of it would be attributable to admin staff, attributable to building related, and then attributable to equipment. So let's put that down as 20,000, and then we're left with an additional 5,000. So again, under other. So that would be anything that doesn't fall under administrative, building, or equipment. And again, here we really want these two numbers to match. Or ultimately the sum of these numbers over here to match the total that you've inputted over here. The next question is around the average hourly wage for each position that your organization employs. Where possible, please also add the average annual salary. So for example, if you have advanced practice nurses at your agency and the hourly wage is $20, you could input that here. If you know that the average annual salary is $100,000, you can input that here. I'm really, again, just using dummy data. You would only need to enter this for the provider types that you employ at your organization. So you could leave blank all the rest, or you could, for example, input, we've got a psychologist, psychiatrist as well. The average wage is $40 an hour, and the average annual salary is $200,000 a year, for example. If you did have some other categories, you could specify what those are below. The next question moves on to salaries and wage and fringe benefits. So if you could just give us the total across the entire organization. Here, for example, we could put 800,000, and then fringe benefits could, for example, be 400,000. Again, just really using dummy data here. Then the next question is around some challenges that you may face in maintaining your workforce. Here we ask you to select all that apply, but do also want to note that you could hit other and then provide additional specification if none of these truly match. And in these other boxes, you can always just type free text. And then the next question, is there any additional information you'd like to provide with regard to staffing or workforce? That's really just anything else you think would be helpful for our team to know as we go through this process. And then similarly, is there anything you'd recommend we improve to be done to improve the workforce shortage in Maine? If you have no response on this, you're welcome to just enter NA. Then moving on to the final section of the survey, what you'll see here is the 3 codes that we had selected about 2 pages back will now pop up with a series of sub-questions. And the structure really looks like this. You've got your code, and then there's 3 sub-questions. So this first big table, the second table, and then a free text box. Then we move on to the next code. Very similar structure: table, table, text box, next code, table, table, text box. Depending on how many codes you selected, you should be able to see the same number of codes on this page over here. So anything you selected on a previous page should pop up here. We want to give you the opportunity to provide input at a service code level so that where there's specific nuance and difference across service codes, this information will be provided to us. We do encourage that you answer each and every question, but if you're unable to answer a particular question, don't worry about it. You can leave that one out, and we will just take the information that you do provide us with. So the first question is asking for you to input the proportion of services under this code carried out by each provider type on average. And what we're trying to understand here is the average contribution of each provider type for the service so that we can ensure that the wages that go towards understanding what the rate should be as part of the rate determination process are as accurate and adequate as possible. So for an example, if the service under this code is a behavioral health consultation and 20% of the time when this code is billed, the consultation is performed by a psychiatrist, we would want to put 20 under psychiatrist. If 80% or 60% of visits under this code are performed by psychologists, we'd want to put 60 here. And then if the final 20% are provided by counselors, we would put that under counselors. So here, once again, we want the percentages to add up to 100% because we'd like to understand out of all of the times that you bill this code, what proportion is it provided by which provider. Moving on to the next question, here we look at some of the non-direct service as well as direct service elements of the code. So the first question is, on average, how long do you require to perform a single unit of the service? So if your typical consult under this code takes 15 minutes, you could input 15. If it typically takes 20 minutes, you'd input 20. But that is really just performing the actual single unit of service. Then we ask what proportion of individuals that you provide the service to you would have to travel in order to provide the service. And then we ask that you answer this as a percentage. So here, let's say 50% of the individuals that I provide this service to require that I travel there. Then we are asking, on average, how much time do you spend traveling per unit of the service? The answer could be 0. It could be 25 minutes. And then on average, how many miles do you travel per unit of this service? Again, you could put 0, you could put 100, you could put 5, whatever is truly relevant and on an average basis for you. Then we ask how much time you spend conducting administrative work. So let's say 10 minutes. And then the final question is, if you provide group services, what is the average group size for the service? So if the average group size is 2, for example, under this code. Please do note you can leave this blank if it's not a group service, or you could just enter, I guess, 1, sorry, not 0. One thing that I do want to note is this administrative work could include a variety of things, including documentation, billing, operational support, that sort of stuff. Then if there's any additional information that isn't captured above, but you think would be relevant to this, please do provide that in this input box. Once again, you're welcome to enter NA if you have no additional inputs to provide to us. Then we move on and continue to do the same thing for the next code. So for this code, I'll give an example where 50% of the time this code is provided by an APN and 50% of the time it's provided by a certified nursing assistant. Once again, I'm really just entering dummy data in here. On average, we'll say 15 minutes. We'll say 10% of individuals require travel. We'll say of that 10% of individuals require travel, it's usually 15 minutes that we spend traveling. I'll say that we normally travel 5 miles and that we usually spend 10 minutes doing administrative work and the average group size is 5. Once again, we have this input box, and here I'll add a note saying additional Then we move on to our final code here. Let's say that 100% of the time the service code T2035 is provided by an LPN. Moving on to the next question, we'll say it's typically a 30-minute service. We never have to travel, and that it takes about 5 minutes of administrative work, and it's not a group code, so we'll leave that one blank and no additional input. So that really just gives you an overview of the types of questions that you would have the opportunity to answer at a service code level. And once again, only the codes that you selected in the previous sections would pop up on this page. When you hit next, you'll see a message thanking for your participation. Please click submit below to finalize your submission. Once you've hit submit, a thank you screen will pop up letting us know that your submission has been received. So I just want to thank you all again for watching this video, for your participation in this rate determination process. We truly value it and look forward to having any questions and comments come through on that email address previously provided. Have a great rest of the day.